It came to attention because through our outreach program to the district hospitals and the health centers that there was a problem. So we decided to just go and see what how bad the situation is, who is doing what, and what the gaps are, and what Amref can do. The situation is very bad, affecting mostly children, mothers, breastfeeding mothers, pregnant mothers, and of course the population at large. From my perspective, there's a lot that Amref can do. I think this area has not benefited from much donor support. We only saw really Save the Children UK who are on the ground, and they're overstretched. They are not doing everything. I think the main gaps that I saw, which in line with what Amref does, is the water and sanitation situation is very bad. Most of the population are relying on shallow wells. They are not protected. They use buckets, no hand pumps. They are using the same source for people and animals. So the chances of getting waterborne diseases are very high, especially now. Amref can easily come in using our experience from other arid areas, at least by supporting them to protect the wells in the short term, at least supporting maybe some installation of hand pumps. And then in the long term, we can work with the government to explore the options of a combination, water, sanitation, hygiene, and conservation. Not sure how feasible it is, but that is in the long term. For right now, really, is to make sure that we can work with the government and a few other partners to avail safe water to the communities. I think the other area that we saw, there are quite a number of very severely malnourished children admitted in the hospital, but also quite a number that are between moderate to severe malnourished. And from what we were told, the food supply from World Food Program is not enough. I think for me, when I hear them reducing the target from under 5 to under 3, that is a serious issue that should be looked into. Because, I mean, the under 5s, most of them we saw either at the health center, who had come for assessment, but even in the communities, they have some form of malnourishment. There's no food. I didn't see any much support in the communities, and I think Amref can come in with your support from donors and see what we can do. I think the clinical and medical outreach is something we can immediately do because the hospital is grossly understaffed and overstretched. They're out of the basic drugs and some of the supplies, and that's something we can quickly work with other partners like Philips Pharmaceuticals and others who have offered to help to avail some of the drugs that they needed. I think an outreach focusing on pediatric care, maternal care, and people who are good with family medicine. And then, of course, we have the routine outreaches for surgical, but we need to do that immediately. And that is something we can do in the shortest possible time. Having seen this, I think there's need for us to be more proactive in future. Wherever we work, we should always not just go there to do the routine work, but always have like a second eye. What is happening around me? I think going forward, as Amref, whatever we do, whichever community we work with, we need to always look out what is happening, what is the bigger picture, and see how we can best work with other partners to make sure that we prevent such things like having children and even adults dying of hunger in the future. And I mean, for me, I think that's the big picture. We just don't focus on the routine work that we do, but always look around what is happening, like having a holistic approach to everything that we do.